In this video, we will start to think about how to address attitudinal barriers in your health service and promote a culture of disability inclusion. In healthcare, there are two key contributors to attitudinal barriers. First is poor knowledge and awareness of disability and disability-related issues at an individual level among health service staff. In many places, education and training on disability and disability-inclusive health is not a compulsory part of training and curricula for health workers. Because healthcare providers often have limited or no formal training on disability and disability inclusion, they start their working lives without the knowledge and skills required to provide appropriate healthcare to people with disability. In addition, healthcare services rarely offer professional development or in-service training and capacity building about disability inclusion to their staff, further undermining their capacity to provide inclusive services to people with disability. The second contributor is health service policies and practices that are not inclusive of disability. This stems from poor awareness of disability among those involved in the planning, design, and implementation of health services, which flows on to a lack of disability-inclusive policies and procedures. Many health services do not consider disability in their planning and therefore do not allocate budget to support disability-inclusive practices. This can lead to a lack of capacity to provide accommodations for people with disability, to provide training for staff, or have flexibility in policies relating to service delivery that will enable inclusion. So what can we do about this? There are three key areas in terms of addressing attitudinal barriers for people with disability in healthcare. First, training on disability needs to be integrated into pre-service training curricula for health workers. While the responsibility for this is with training and professional bodies and not health services themselves, health services and health workers can advocate for disability to be included in pre-service training, including through their professional associations. Secondly, health services should provide in-house training and capacity building sessions for all health service staff on disability and disability inclusion. And this should include both clinical and non-clinical staff to foster a service-wide culture of disability inclusion. And thirdly, health services need to review their policies and procedures to be disability inclusive. The last 2 points are actions that can be undertaken by health services. Over the next few slides, we will take you through some practical steps of how to address these. Let us now consider some practical steps that you and your health service can take to implement in-service training on disability. You can also find further details on pages 32 to 33 in the toolkit manual. The first step is to assess the current knowledge, awareness, and attitudes to disability among staff in your health service. You may wish to do this through a confidential survey or through some focus group discussion sessions. Use this information to identify the key gaps in disability knowledge and awareness and prioritise areas or topics to be addressed. Next, start to develop some training materials and activities that address the priority areas or topics that you have identified. Remember that DPOs and people with disability in your community are an invaluable resource and may be able to advise or assist you with the development of these materials. Once you have developed your materials and activities, deliver your training. Ensure that all members of staff, both clinical and non-clinical, have the opportunity to attend. Evaluate your training. Use feedback mechanisms to get feedback from participants, but also monitor for change in behaviours and practices towards being more disability inclusive following your training. And finally, repeat the training on a regular basis, perhaps every 6 or 12 months, to ensure new staff receive this training and existing staff have the opportunity to undertake it as a refresher. On the next couple of slides, we have listed some potential topics to include in your trainings for staff, as well as covering topics such as foundation concepts on disability, like those included in Module 1 of this training package, inviting people with disability to present and give a first-hand account of their experiences of accessing healthcare services, both positive experiences and challenges, can be a very powerful training tool. Other training topics might include how to communicate with people with different types of disability or impairment, screening and referral processes for identifying disability-specific needs, or addressing physical barriers to make your health service or clinics more physically accessible. There are more suggestions in the toolkit manual on page 33, but also seek suggestions from your colleagues as to what they would most like to know about and what would help them feel more confident in providing healthcare for people with disability. All organisations should have a disability inclusion policy. At the end of this module, we encourage you to check whether your service has a disability inclusion policy, and if not, to use the template on page 35 to 36 of the toolkit manual to assist in drafting one, or direct the relevant person or people in your service to this resource to assist them in drafting a policy. In addition to having an overarching disability inclusion policy, it is important to review all of your health services policies and procedures to ensure they are disability inclusive. This includes all areas from clinical services to human resourcing to child protection policies and policies relating to finance and administration, just to name a few. Consider policies and procedures relating to transport, payment of services, health service hours, location and scheduling of appointments. Do these include reasonable accommodations or flexibility for people with disability in terms of communication, physical access, or financial support? We have created a checklist on page 34 of the toolkit manual to assist you with reviewing or auditing your health services policies and procedures to check whether they are disability inclusive and identify any areas for improvement. And finally, let us take a moment to reflect on what impact we can have by promoting disability inclusive attitudes in healthcare and removing attitudinal barriers. For people with disability, disability inclusive attitudes will provide a more positive experience of healthcare and a better quality of care. This may result in people with disability being more likely to attend follow-up appointments or seek healthcare again in the future when they need it, and encourage others to do the same. This in turn will contribute to improved health and well-being for people with disability, as well as the potential for reducing demand on caregivers or other supports. As well as benefits for people with disability, there are benefits for health workers, health services, and the health system more broadly. Promoting disability inclusive attitudes through training and awareness raising in health services can increase the confidence of health workers when interacting with and caring for people with disability. This can contribute to a higher quality of care and greater worker satisfaction. From a health service perspective, by providing an inclusive health service that people with disability feel confident and able to access when they need it, will improve health outcomes and potentially reduce demand on the health service in the longer term. We hope that this has assisted you to think about how to address attitudinal barriers and promote disability inclusive attitudes in your health service. Now return to the workbook and complete the activities in steps 5 and 6, which will give you the opportunity to apply the knowledge from this video.